Welcome to Chatterbox Besties with Brenda and Ricky. We're two besties sharing news, gift ideas, and lifestyle hacks to turn ordinary days into a 10 plus. Well, today we'll be discussing skincare truths and trends with our renowned guest, Brittany Croasdell, clinical director and co-owner of Fulcrum Aesthetics in Lakeview in Chicago. She is a nationally board certified nurse practitioner, a published author, and an international trainer in aesthetic medicine. Brittany is truly the heart behind Fulcrum Aesthetics with a focus on high quality care.
And we're proud to say that today's episode is sponsored by Fulcrum Aesthetics. It's dedicated to providing premium surgical and non-surgical beauty services that enhance and rejuvenate your natural beauty. As a leading practice in Chicago, Fulcrum promises each patient, and I can attest to this, very personalized care, focusing on educating you and providing treatments that align with your personal goals. And as a bonus, they also have this gorgeous space designed to put you at ease when you arrive. And frankly, it's spectacular and very spa-like. So try it out.
That's awesome. Well, we have a special bonus for you as well. If you're listening to this episode and you book an aesthetic service as a new client at Fulcrum Aesthetics, you will receive a complimentary Aura 3D skin analysis. That's a $150 value. And you can really, with this technology, you can actually understand what's actually going on with your skin. Like, who doesn't want that? So be sure to mention Chatterbox Besties when you book this to get this awesome analysis for free. Such a great offer. Details will be listed in the show notes, and I'm going to definitely go in for that one, actually. We also have a very special giveaway going on right now on our Instagram. It's another lovely giveaway from our Fulcrum partners. It's a $350 value of goodies. So you can go to our Instagram when you're done listening to the podcast. You can see all the details. I think you're going to be just as excited as we are. So anyway, before we actually get into Brittany, I know you're sitting patiently in the background. She's going to set it straight. But before we do all of that, Ricky and I have to catch up because that's just what we do on Chatterbox Besties. And here we are. It's February. Happy post Valentine's Day. So Ricky, how are you? How was your Valentine's Day? What's up?
Valentine's Day was great. And I just have a little story about my grandson because he didn't
Ooh.
understand what Valentine's Day was. So I said, it's the love holiday and everyone shares their love. And he goes, where does love go? And I said, well, it's in your heart. And he's 4 years old. And that was kind of the end of the conversation. And then 5 days later, he asked his mom if he could write a Valentine to his teachers because his heart was so full that he wanted to show them how much love he had for them. And I thought that was so cute.
That
So
is
you
the
never know what they're
cute.
listening
So
or
sweet.
absorbing. Yeah.
I
So
love that
it was
so
very,
much.
very sweet.
I
So
know it speaks to the fact that the kids really do listen, even though
they
you don't
do.
think they're listening. It's all filed in their brain. So that is
Exactly.
so, so cool. Aw. Well, we spent some time in California through Valentine's Day. We had a wedding in La Jolla, which was it was beautiful. It's so like regenerative, like walking along that coast. I mean, the water's just crashing on the rocks, and there are massive amounts of sea lions and birds. I mean, it was like a mini Galapagos over there. It was just lovely. So I highly recommend it if you haven't been there. So that was kind of how we spent our early part of February. And now we're like completely obsessed with the Olympics. I don't know if you've been watching at all, Ricky.
I watch a little. I'm sort of intrigued with, well, obviously the ice skating, which everybody loves. But the bobsledding is just incredible to me. The one guy just gets in the back and just goes for the ride. It's
Yeah, I don't
amazing.
get that either, but it looks fun, right? I mean,
Well, yes, yes, yes. So
yeah.
that's my Olympics. I'm
You're
not gonna.
funny. I mean, I love the ice skating too. I mean, it's just like the art, the theater, the beauty, just all of it. And I don't know if you're kind of tuned into this Alyssa
Yeah,
Liu, I think is her name.
yeah. She
Um,
just won the gold.
she won the gold and she has such an amazing story. I mean, she was pressured as a young teenager to like do all the things and She competed, I think, when she was, I'm going to say 16 or so, and she hated it. So she just quit. She quit. She went to Nepal. She went to college. And then this is so interesting. She went skiing one day and she had this like exhilarating feeling, and she realized she missed that feeling from her ice skating days. So she decided to go back on her own terms. And she is such a, oh my gosh, she has such a wonderful personality. She actually said she wants to do this because she loves the art of it. And to her, the medal, or if she medals, it's just like a, just something, like it doesn't mean anything. And to her, it's just performing for the love of it. And when you watch her perform, she has that beauty and the grace as well as the athleticism. And she's just having so much fun. She just looked super authentic. And it was really special to see that. So I loved that. I loved her. And I love the way she was cheering on for all the other athletes. So she's got a really great, she's grown into this really wonderful woman and just really showed how important it is to kind of like cheer each other on. Like women need to support women. And whenever we see that example, she's a great role model. So I'm just all about that. So, but yeah, I love the skating. But I do want to mention one other thing, Ricky, and I don't even think we've chatted about this. So when I was in West Hollywood, I actually happened to walk into the Skims store, Kim Kardashian's new kind of leisure wear and undergarment store. And I was so impressed with just the aesthetic of it all. I mean, it was just so beautiful. And now we have one in Chicago. And I have to say, I don't know if you've checked it out, but it is like the Apple store for undergarments. I mean, I'm telling you, every detail from the product to the environment and to the training. I mean, the way the salespeople, they kind of take you into the fitting room, they strategically place the items. They're not just throwing you in with the garments. I mean, every step of the way, they are trained to perfection. And I was really impressed because I thought, well, I got to try some stuff on just to see. And I will tell you, I was very impressed with the product. They basically took like the traditional everyday undergarment that you may buy over and over again because you like it, and they kind of upped it a little, made it a little more modern with a little bit of a better like modern fabric. And the price points are great. I was so surprised, and now I'm a huge fan. And honestly, I think they're the modern day Victoria's Secrets, to tell you the truth. So I just loved it. So I had to talk about it because it had the spa like kind of feel. And so as we are thinking about spa feeling and like kind of, taking care of yourself, I think we need to get into Brittany because we're so excited to talk to her. So Ricky, why don't you introduce her officially?
Well, I've known Brittany. God, I don't even know how long I've known you. I'm only 25, so it
Yeah,
can't be that long.
this year.
But Brittany she's awesome. I am such a huge fan. And I think I'm a fan. I mean, obviously you have the expertise and the knowledge and all that, but she has got the strongest moral compass and focus on precision and safety and patient-centered care. And I'm just really excited because she's here to debunk the myths of all skincare and to clarify the noise of skincare. And I know I already said this, but I'm absolutely thrilled to have her on our podcast today. So welcome, welcome. So
Thank you so much.
a
I'm
couple.
also very thrilled to be on. I think I was one of your guys' first cheerleaders when you launched your first
Oh,
podcast.
oh, I really
So,
appreciate that. So,
and I also meet like little fangirl real quick over Ricky. Every time Ricky came in, everybody and myself, I was like, I cannot wait for a new outfit on inspiration. All the time. I was like, what are you wearing? Can I take a picture of it? Reverse Google search it? What are you wearing? What are you
Love
wearing?
it.
Yeah. So
had no clue, but she does have the most amazing staff. From the second you walk into this gorgeous med spa, it's like you've gone into someone's living room. I know a lot of people are scared, apprehensive, but they're never going to steer you wrong. And when you leave, you definitely have that sparkling glow. It's pretty spectacular. And I think it's also unique that you have this spa with your plastic surgeon husband. A lot of spas don't have a doctor on staff.
Mhm.
Okay, I need to say that he's absolutely adorable. He's so kind. He's so funny. He's so nice. I mean, everything about this, you before you even get there, they're asking for your drink order. And I'm like, where are we going here? There's fancy coffees, there's fancy waters, there's teas, it smells amazing. They have all these wonderful products, but they will never, ever, ever try and sell you something that you don't need. And I can attest from that personally. So, a little background on you, Brittany. How did you become an esthetician and what made you passionate about skin?
So I'm a nurse practitioner, which is a different distinction from an esthetician, but it's very commonly mixed up, used interchangeably. A nurse practitioner requires a minimum of a master's degree. You have to start with your nursing license. So usually it's you start with your bachelor's, continue on from there, and then a nurse practitioner continues on and is able to then assess and diagnose and then prescribe. So that's a distinction between a nurse practitioner and a nurse. Whereas an esthetician, they take a course in skincare and they become what's called a licensed esthetician with the state. So their
Wow.
focus, their scope of practice is just on the dead layer of skin and above. So they can do
Okay.
really beautiful facials. They're product aficionados. They know their skincare like the back of their hand. And whereas a nurse practitioner is really whole body and not just focused on just the face, it's whole body um, anatomy, physiology, all of that fun stuff.
Oh, interesting. How would you say your spa is different than other spas?
So when I really started thinking about Fulcrum, I really wanted something that r- really encompassed everything that the average woman and or man needed when they came into an aesthetic spa. And I like to think of us as an aesthetic spa instead of a med spa
Oh,
because
interesting.
we have the medical component with it, and we really do specialize in the lifespan. So the continuum of that patient's lifespan, we want them to heal. Every intervention that we make, we think about that 10, 20 plus years later, and
Wow.
think about how the patient's going to age. And we think about how their lab work looks in conjunction with everything. We truly do think about that as an entire clinic. But when I was thinking about Fulcrum, at the time, there were so many specialty clinics, and a lot of my patients were going from one office to the next office to the next office.
Right.
Someone was going to the OB
Yeah.
hormones. Someone was going to, they were seeing their facialist or esthetician at another clinic, and then they were going to get their injectables somewhere else, and they were getting their plastic surgery somewhere else. They were seeing their internist somewhere else. And in the US, none of us communicate. And
Hmm.
Oh,
none of
wow.
these specialties communicate. And a lot of patients, aside from you, Ricky, you're one of the few that stand out that are really well informed. A lot of patients are unaware of everything they've had done from clinic to clinic to clinic. So trying to tease out history, medical history from patients that was relevant to me when I'm injecting them, the patient may feel that it doesn't matter, like, oh, I just had a tooth implant, a dental implant, that you don't need to know that. I really need to know that. And oh, I had silicone injected 10 years ago at, a luxury travel space in Greece. I need to know that. So what I was coming up against was so many patients were getting specialty care elsewhere, and we were creating little silos for patients.
Hmm.
We weren't
Wow.
able, I wasn't able, it limited my ability to give the patient everything that they needed because I approached it very cautiously. If I didn't know, I wouldn't do the intervention that they really needed. I would play it more to speak, like a little bit safer,
Hmm.
something that was generally pretty safe. And even if they did have XYZ done, it wouldn't interfere. So having a space where patients can come in, they can meet with a hormone specialist if they need to. And she's Menopause Society certified. So she specializes in perimenopause and postmenopausal care specifically for women. being able to look at patients' labs when they're saying, hey, you injected Sculptra or you did this laser. I'm not sure if I see a huge difference. Being able to see where their hormone levels are, because as
Oh, wow.
our hormone
Yeah,
levels decline, we're not producing enough collagen.
right.
So it helps me tailor treatments, and I will combine a laser base with a biostim then in that case. Um, that's what I wanted to create, was something that patients came in, we had multiple specialties under one roof, and we all communicated. And something else that's really unique is in one of my colleagues is in the Netherlands. And anytime you see a specialist outside of your primary care, it is a requirement that that physician writes a letter in behalf of that patient, sends it to the primary care physician who oversees all of it. It's a law, a requirement. We don't have that here.
Mhm.
So that's why I wanted a space that we could all work together for the best outcome for the patient.
Oh my God, I love that.
Yeah, I
That's
love that all-encompassing outlook so that really you can look at the whole person. That's so important. Love
Yeah.
that. Well, let's transition into the whole skincare idea because there's so many big myths about skincare. We're all so confused. So I'm so excited to have you straighten it out for us. So I think one of the first big myths is that more products equal better skin. So, why do so many of us think that complicated routines are the answer?
I think we're I myself am every marketer's dream as well. I think some of us just fall prey to really good marketing and
Right.
really pretty packaging,
absolutely.
right? Like even
Yeah.
talking about going to the skim store, I want to go just to see as
Yes.
Yeah. Yeah.
when I
You're
hear it's
gonna
opening, I'm gonna grab a coffee, I'm gonna walk through skim,
Yes.
see, yes. What
totally.
can tempt me to buy another bra that I don't need? You
Oh,
know?
we always need another one, but
So I think that for a lot of people, and I'll speak for myself, it's great marketing, having something pretty that sits on your shelf, and also the hope of maybe this will do something different,
yeah,
right?
true.
And then it gets a little confusing because maybe we have, three different kinds of face washes. Maybe we have 10 different kinds of shampoos. Maybe we have 13 different kinds of body lotions because of the scents. It smells a little different. Or
So
there's one
true.
that are
Right.
yet, to see. And then there's the one that we actually use with retinol in it.
Yeah.
That's not as pretty, so I think there's a lot of that. I
Right.
definitely think there's a lot of that. And then there is also a little bit of a misunderstanding of the ingredients. And when I talk to patients,
Yes.
there's a lot of duplicates. They'll say, oh, I'm using this and this and this, and it already has vitamins. This has a vitamin
Yeah.
C. This has a hyaluronic acid. This has exact same peptide as this one, but they're using it all and they don't necessarily need to be.
Yeah,
Wow.
yeah, it's so interesting. So how would you, and I know it's probably very specific to each person, but if you had to basically say, okay, these are the products you should generally be using, until you get sort of a full-on analysis and kind of hone in on what you really need. Like, what would you recommend? It is so confusing.
Can I make four? Just
Yeah, four is good too. It's way less than what I have on my in my bathroom, so I'll take four.
I would love to add a very, very basic.
Okay.
Everyone should have a good facial cleanser.
Okay.
And so that is where it's a little bit dependent on your skin type. If you have super sensitive skin, do a gentle cleanser. You could even do a creamy cleanser, something non-soapy, non-foamy that
Okay.
doesn't strip your skin. But you should be washing your face twice. Once in the
Oh,
morning, once at night. Even if you have super dry, sensitive skin, you can use a creamy cleanser that doesn't overly strip it, but you need to wash off the day, right, at night. And
yeah.
then in the morning, you sweat, you put skincare products on your face at night. You need to wash that off and start over.
Hmm.
So, a good face wash, and this is where it does depend on your skin type. You can either do one that helps correct, reduce oil production, or a nice gentle cleanser. The next one is going to be an antioxidant, such as vitamin C.
Oh,
Uh,
okay.
And so everybody should be on a potent antioxidant. I like topical vitamin C's. Those are really quick and easy to get. You can get them pretty inexpensively at Walgreens, or you can get higher grade, like pharmaceutical grade quality skincare at your medical offices.
Okay.
And so that really just depends on patient preference and their skin tolerance. Then next one is going to be a retinol or tretinoin. A retinol is a nice, easy way, usually a little bit more well tolerated for patients. And the reason for that is retinols or retinoids, they correct dyschromias, so pigmentation disorders. They
Okay.
help reduce sebum, so they help reduce oil production. They
Mm.
essentially help with smoothing out tiny fine lines. They'll upregulate collagen production on your skin, decrease fine lines and wrinkles,
Wow.
which is really,
Interesting.
really, really important.
What we're
So,
all trying
like,
for.
yeah, this is your retinols are our fountain of youth in a bottle.
Okay.
It addresses everything: acne, dyschromias, fine lines, and wrinkles, right? So
Wow.
why
Wow.
why
Yeah.
not? And and then finally sunscreen. Everybody should be using
Yeah.
sunscreen.
Good one.
Yeah.
Yeah, we'll
Excellent.
definitely talk
Excellent.
about how do we tell the difference if something is burning or tingling? Does that mean it's working, or is that irritation? And can you talk a little about that?
Yeah. So there's a spectrum, and it really depends on what active you're using when we think of is burning, tingling good or bad, and was it
Exactly.
intended or not. So for all intents and purposes, we'll talk about just home use,
Okay.
not medical grade stuff, because
Oh,
sometimes,
yeah. I'm just talking about at home.
oh yeah, yeah. So just home use. You don't want it to burn or tingle too much unless there's a menthol in it. Menthol, sometimes they'll use that for medicinal purposes to drive it
Sure.
down a little bit deeper. Um, if you're using an active, so a retinol, for example, if it's burning and tingling, it's probably a little bit too strong for you.
Okay.
Okay.
And you might want to mix it with something like a good facial moisturizer. You can use Vanicream, for example, or a nice Cetaphil or La Roche-Posay face lotion to kind of blunt it.
Mm-hmm.
Retinol is a vitamin, it's a fat soluble vitamin, so it's vitamin A.
Okay.
And so it does not reduce the efficacy, but it will reduce the irritation on the surface of the skin while it's getting into the deeper layers of the skin. So we want that moisturizer to create a light barrier. It's not a barrier to efficacy, it's a barrier so it doesn't cause contact dermatitis and sit on the surface of your skin and irritate it.
Interesting.
So, and then there's vitamin C's. A lot of patients get contact dermatitis from vitamin C as well.
Okay.
Um, and I don't love, so when you start feeling a little tingling with vitamin C, that's when you probably need to change the formulation and look at
Oh,
another brand.
okay. So
So pain is
interesting.
not gain in this situation,
Pain
To
is
be
right?
careful.
usually not gain. Pain is
Okay.
Yeah.
usually gain,
Yeah.
yeah.
Are there any other sensations that should raise a red flag when you're using
So,
these are all at home, by the way.
yeah, burning and itching, I would want you to pay attention to. And then if you start getting swelling, so anytime you have
Oh,
swelling
okay.
around the
Been
mouth,
there.
yeah, anytime you have swelling around the mouth, that's when we start worrying about something that's called angioedema, and you're having a true allergic reaction, not
Okay.
just urticaria, which you have like red, blotchy, itchy,
Yeah.
high.
Yeah.
But we worry when there might be significant swellings that would
Okay.
cause angioedema.
Great. So another myth out there is that expensive products are always better. So where is it worth your money where's money well spent in skincare? And then what are some affordable ingredients you love just as much as luxury ones?
So expensive is not always better.
Okay.
However, usually the more if you're getting it from a physician dispensed office, or if you're getting it from there are chemists that formulate. I know there are a couple of like new chemists that used to formulate for, I think it was like Neutrogena. They're
Oh,
coming up with own lines now. They're a little bit more
Interesting.
expensive, but they're formulated really well.
ah,
So no, expensive does not mean better necessarily. Like we know La Mer, for example, it's just a very expensive moisturizer. However, if there's actives in it, that's where I do believe you get better
I
quality.
see.
When you have growth factors, certain peptides, when you have retinols, when you have certain ascorbic acids, those are vitamin C's, um, when you have DNA repair enzymes, that's when you want to look at how it's formulated, the integrity of the company that you're buying it from.
Yeah.
Do they have
Wow.
white papers, so to speak, or studies that they've shown? They've done punch biopsies to show efficacy. Because remember, with skincare, none of this is truly regulated by the FDA
Right.
because it is
Right.
personal. Yeah. So the FDA sees it as personal care, and that's up to you. So there's a lot of really, really pretty products out there, and you are paying for beautiful packaging.
Yeah.
And
Right.
then there are others that are not so pretty, but you're paying for, well, pure ingredients, and
Right.
high pharmaceutical grade ingredients. So ingredients that are sourced well and are stable.
Right. Which makes sense, which leads into, I think, what Ricky's going to talk about next, which is,
Well, I
yeah.
just wanted to ask, how do you even know about pharmaceutical grade? Because sometimes, they say it is. I'm not going to use any names, but a doctor's name may be on it, but it's not really medical
Yeah.
grade.
Yeah.
So, and it's
So,
expensive, so you think it's worth it.
yeah. So so medical grade skincare is a marketing term.
Mm-hmm.
But what that means to me, so when I started off in this industry, we had tons of reps coming in saying, this is medical grade, this is medical grade because it's only dispensed in a physician office. We'll only sell to physicians.
Mm-hmm.
And now as we've gone on, we've learned that there's really not a ton of oomph behind that terminology. It is a really nice marketing terminology. But
Mm-hmm.
what I think of it as for patients who are buying skincare in a medical office, you also get that care. If you do have contact dermatitis, if you do
I
have skin
see.
irritation, if you do have other products that you want to mix in,
Oh, wow.
they guide you through that. Whereas if you
Yes.
buy it from Sephora, you're buying it from Blue Mercury, they don't care and they're not going to
Mm-hmm.
manage you when you have your next rash or breakout.
Right.
That's a huge point because often the price points are the same,
Yes,
but there's no guide for you.
Right.
yes,
And I can personally attest that if there is an issue, you just pick up the phone and they are answering right away, and
yes.
that's huge. Um, Natural versus clean. Again, I know we're not regulated, but what is that? Is it is there a difference? Is
Yeah.
this
Is it
just
real?
Yeah. So it's also another marketing term, and when people are moving more towards organic, they want less chemicals. It's hard because it's hard for me to understand because everything we put on our skin is a chemical, right?
Right.
So, water molecule is a chemical. So we have to really be careful with the vernacular and understand what we're saying. And I think what most people are saying is they don't want harmful chemicals on their skin that could potentially lead to tumors, cancers, or any
Yeah.
hormone
That's
disruptors.
real. Yeah.
Yeah. So that's what I believe people reference when they're saying that. It just gets used quite a bit without understanding of what they mean by it. So natural or clean skincare are generally seen as ingredients that we find in nature, that we don't have to mess with the molecule too much,
Okay.
or engineer it too much into something else. So think of like your blueberry face scrubs.
Mm.
So
exactly?
typically there's like, remnants of blueberries in it, where you get the potent antioxidant, a little bit of lactic acid they might put in there, which is from milk. And they might use some sand or pumice stone that they break up in there to help exfoliate the skin. So that's when you're looking at maybe 3 or 5 ingredients in skincare versus the 20 that sometimes we see. I will say though, the 20 aren't necessarily bad. You just have to be comfortable reading labels and understand which
Yes.
ingredient is. So with natural and or clean skincare, it's usually fewer ingredients, items that you would find naturally in our environment. And the company is trying to optimize that for skin. I know there's a lot of like avocado face
Yes.
Yes.
masks.
Yes.
Yeah, and I think those can be really lovely, but you have to understand what they're doing for you, and it's usually quite limited. If you're trying to really move the needle, you're really trying to
Yeah.
lift pigment in your skin. If you're trying to eradicate a fine line, Those products generally aren't going to do that for you, but they will moisturize really well. They might protect your skin. They might help with the microbiome, depending on what it is. But remember, natural also can cause severe allergic reactions, like
Oh,
lavender oils, peppermint oils. A lot of skincare is, you'll see like even lemon oil in it, which will
Yeah.
lead to a really significant skincare burn if you put that
interesting.
on and walk outside without sunscreen. So just because it's natural doesn't mean it's safe.
Let's get into our next myth where you only need sunscreen on sunny days. So tell us why SPF is so misunderstood and what's the whole story behind sunscreen?
So the myth of you only need sunscreen on sunny days, I myself, when I was a teenager, thought the same thing. Um, but it's because there's UVA and UVB rays, and think of UVA as your aging
Okay.
sun.
Oh, that's a good one. UVA aging. I like it.
And those even go through windows. Like if you're feeling the warmth of the sun, it is aging you. It is causing dyschromia. It's causing cellular changes. Um, that doesn't mean that's necessarily something to completely avoid. We also need, the sun is also incredibly healing. We need vitamin D. I'm not someone that says stay completely out of it unless you have a high risk of melanoma.
Okay.
Um, I think that healthy doses, and dermatologists may disagree, although there are some that definitely agree. Healthy doses. So we live in the Midwest, right? I think
Right.
are we like zone 5 or something like this? We get very little amounts of vitamin D about 6 months out of the year, and then we get copious amounts, which is why we burn. Little bits, 5 to 10 minutes a day in the 6 months that we actually have sun should not be incredibly harmful, but you want to be mindful of it. Sunscreen is important. UVA, aging rays, even go through a window. UVB are your burn rays. That's where you get your
Oh,
Oh,
wow.
um,
look at us. We're kind of like, holy
Whoa.
cow, all these years.
and
Light bulb.
yeah, and usually um, passive UVB rays are filtered through many windows, so that's why we don't necessarily get a sunburn unless it's direct and you're driving in a car and you're driving a road trip and you're 4 hours.
Yes.
Yeah.
Yeah, that if you leave that out for all, you will get a sunburn. So I think of it that way. So you definitely want to use sunscreen to prevent the aging rays, UVA rays, and then UVB as well. So if you're indoors and it's not like you need to be petrified of walking past a window. That's a bit extreme.
Okay.
But definitely be mindful. And if you do work next to a window and you're like a desk, you're a computer worker, you are going to want to reapply your sunscreen because you will continue to see dyschromia, so discoloration, sun damage.
Ah.
It will definitely age you. There's a great study of a trucker who was a trucker, I think, for 40 plus years of his life, and it hit one half of his face severely aged, the other half not. And this guy
Wow.
was in the sun while he was driving,
Wow.
Wow. That's
significantly,
unbelievable.
yeah, significantly impacted by that direct sunlight.
Huh.
Wow.
So how do you know like 30, 50, 70? I mean, I sit there and I stare at all these options and then I just go for the middle one because I don't really know what's enough or what's overkill.
So there is mineral sunscreen, chemical sunscreens.
Okay.
Mineral sunscreens usually create that white cast over your skin, so
Yeah.
think zinc. So it's often zinc doing that. And chemical sunscreens are clear. So a lot of people like to do chemical sunscreens on the body because you won't get that cast on your,
Yeah.
it's oily. And in the US, there's sunscreen wars going on in the US versus abroad because there's different types of filters and other sunscreens abroad. And here there's also an ingredient in it that people don't like. But with that being said, sunscreen is a necessity. I don't care what kind of sunscreen you use. If you prefer mineral versus chemical, just put sunscreen on to protect yourself from skin cancers. That is really, really important. Make sure you're doing your skincare checks with your dermatologist. And the sunscreens that a lot of patients like to use, and it depends on your skin type, because your Fitzpatrick's 4, 5, and 6, so darker skin tones, melanin-rich skin tones, if they use a mineral sunscreen that leaves a white cast on their skin, and so it doesn't look super nice, and so they
Yeah.
often go for a chemical type of skin sunscreen, unless you can get a tinted sunscreen with the right tint. And there are different brands that are really finally coming with some good products for
Mm-hmm.
all melanin-rich skin tones.
Okay. So the
Wow.
number doesn't really matter if it's a 30 SPF, 50 SPF.
So the number tells you the length of time you're protected from the sun.
Oh, I see. So half hour versus, okay, I don't think I ever even knew that. To
Yeah.
tell you
So
the truth.
yeah, the number will tell you the length of time that you're protected from the sun. And usually if it's water resistant, it'll say the length of time, like if you dip yourself in the water, you're good for 30 minutes. So think
Okay.
about how often you have to reapply. And that's why people will, tan through it, so to speak.
Yes.
Oh, wow.
That
Like
is
they'll use
so
SPF,
interesting.
yeah.
Yeah.
Like they get the SPF, like the Banana Boat SPF 5 oil.
Yeah.
5 minutes. It's
Don't even
pretty
do it.
worthless.
Yes, don't even do it.
Like the baby oil when we were teenagers at the beach.
Yeah.
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 Doing
In
doing
true
nothing.
confession, we all did it,
Oh
unfortunately.
my God, that is such great information for all of us that really have no idea what we've been doing all these years with sunscreen selection. So thank you. That was really helpful. So let's
Yes.
actually move into kind of the whole idea of in-office treatments and try to demystify kind of all the things that go on because there's so many amazing treatments
Yeah.
and you can kind of get overwhelming because there's always something new coming on the market. So, Ricky, why don't you start us off with that
Well,
conversation?
first of all, I want a qualifier. This is not Fulcrum, but other places do kind of oversell treatments that you don't actually need. So, again, Fulcrum would never do this, but um, how do you avoid things that you don't actually need? Because we're all kind of gullible. And when they say, oh, this will just make your skin look like you're a baby's butt or something, we all want to believe, but it isn't always true. So, how do we decide what works and what doesn't and what to go for?
So I feel that there are two components here that are very important. First, as a patient, you have to know what outcome you're looking for to really help guide you.
Okay.
Then as a provider, it's my job to make sure that I understand your goals and I'm giving you the appropriate recommendations. So setting your expectations. So when you go into a clinic and you don't want to be oversold, you won't be oversold if you know what outcome you want, right?
Okay.
If I feel like people who maybe aren't exactly sure what they want and they hear, oh, I should get this, and this, if they're telling you that you should get your lips done and you don't want your lips done, you're really just looking because you have brown spots, you're definitely being oversold, right? So that's a first really easy first step to know. Like if what they're recommending isn't even what you're looking to address, probably
Okay.
maybe maybe
Interesting.
not move forward with it. When you go into a clinic and your provider, it's their obligation to let you know of the downtime,
Oh,
the
good point.
potential
Yes.
risks associated with it, cost, of course, and then realistic expectations. And so that's why a consult is really important when you're looking at energy-based devices. I have a lot of patients that also come in and they really are uncertain about what non-surgical treatments can get them. Whenever I have a patient that comes in and says, I want either a laser or skincare or an injectable to do this for me, I know it's surgery.
Yes.
Yeah, yeah. Because there's nothing that I can do non-surgically to lift
Okay.
that issue. And so for me, that's usually, oh, that's a little note for me, not a red flag. It's a flag for me to come back to and address with the patient to set expectations that you're here for a non-surgical treatment. We have 10 different paths to get you to the same result,
Hmm.
but non-surgically, I can't give you this. Nothing will give you that. And if that's what you're in pursuit of, we need to get you to see our surgeon.
Makes sense. Makes sense.
So
So there,
not being oversold is just is understanding first what you want, and then the practitioner, the provider, it's their also ethical duty to recommend. First, we have to recommend the gold standard, which understanding what they want, we try to pair that together. And so I like to give patients usually at least 1 to 2 options,
okay.
and go from there.
Yeah, options are really important. Sounds like a really great collaboration between the patient and the practitioner. So there are so many in-office options. Let's talk a little bit about, when we think about facials or peels or lasers, microneedling, there's so many things. How should someone think about these just in terms of like maintenance, correction, or prevention? I mean, how do we sort of categorize and how do we understand, I guess, even before we walk in to talk to someone?
So I think of it as, so when I talk with patients, I say we have 10 different roads to get you to your end result. It
Okay.
depends on the downtime that you're able to give us,
Okay.
right? The types, are you looking, how aggressive do you want it to be,
Yeah.
right? So what is your availability for that? And then, of course, how badly do they want it,
Okay.
right? If some patients come in and they say, I want to look 20 years younger, we can do that, but they have to commit usually to a very specific road of treatment.
Gotcha.
And that's going to
Makes
be
sense.
combining multiple steps, including surgery. So when you're coming into a clinic like mine and you're like, what is microneedling? What is radiofrequency with microneedling? What is a chemical peel? What's important? What's maintenance? What's not? Um, I think it's important to have your consult with an esthetician and an injector or nurse practitioner and or your physician, right? Your
Okay.
plastic surgeon. Plastic surgeons in general don't have a lot of skincare recommendations. They'll always send you to the esthetician. When
Okay.
you're looking at chemical peels, for example, chemical peels are going to be a great skin pigment corrector. So it can
Mm.
help correct skin pigment issues. It can help with breakouts, and it can help very minimally so with fine lines.
Okay.
So, and usually for the majority of offices, you're looking, there's a superficial, medium depth peel, and then a deep peel. Very few offices do the deep, deep, deep peels like phenol peels. Um, those require cardiac monitoring, and those are the ones that
Oh,
really
wow.
resurface the skin.
Okay.
For all intents and purposes, where the majority of patients are walking into, they're looking at a superficial to medium depth peel. That's
Gotcha.
what most clinics are going to offer you. So you're looking at softening breakouts, discoloration, and softening fine lines. When we're thinking about microneedling, and making combo treatments of this, like alternating it month by month, is a beautiful outcome for patients. But when you're looking at microneedling, that's collagen induction therapy. So think of, it's a little pen with 25 plus needles on it, going to various depths, anywhere from 0.5 millimeters all the way up to 3 or 4 millimeters in depth, depending on the patient outcome. So patients who have fine lines or deep acne scars, microneedling
Mm-hmm.
is nice for that. Lower downtime, but it requires regular treatment. So when I have, some patients will say, I didn't see much of a difference. I did one microneedling treatment. That's where I feel like the education part was missed for the patient,
Ah,
because one treatment
yeah,
you're not going to see much, and and
sure.
and you shouldn't see much, right? And probably that patient also didn't have much downtime, which is why they chose microneedling, because it's about
Yeah.
24 hours of bright red face, and then you can put on some sunscreen and continue about your day. And so for all intents and purposes, patients, the amount of downtime you can give us is directly correlated to your outcome.
Makes sense.
Yeah, right? If you don't have a lot of downtime to give, you're not going to see huge differences in one treatment. Now, cumulative treatments, you give us 6 months, once a month, you're doing a microneedling treatment. At that 6 month mark, you will see a significant difference,
Interesting.
but it takes longer
Mm-hmm.
to get there, right? Whereas
Mm-hmm.
if you're looking at a laser treatment, so then there's people will bundle in light therapy like IPL or BBL as a laser. That is a light therapy type of medical device. So we'll call it lasers for now. It's broadband light. That doesn't have a ton of downtime, so it's not ablative, but it will help correct your brown spots.
Mm-hmm.
It'll help correct any vascular disorders. If you do regular treatments, it can actually change the way our DNA expresses itself. So the cell
Wow.
will replicate as a younger, less
Oh,
pigmented
wow.
cell. Yeah, it's amazing. It's called the Harvard study. Check out the Harvard study done by
Okay.
Dr. Bitters. It was a 20-year long study with these patients.
Wow.
Wow.
So BBL, superficial, can get through the first two layers of the skin. So we're looking at pigment disorders. You need multiple treatments of it though, because our pigment often lies in all 7 layers of our skin. So at the
Mm.
base layer,
Yeah.
and then we shed the first layer every 30 days. So as
Okay.
1 month, you're getting one BBL treatment, that pigment looks better, and then it's coming to the surface again,
Oh,
and
wow.
another one, and another one. And that's where then your at-home skincare treatments really matter. Um,
Okay.
we can do, pigment inhibitors, tyrosinase inhibitors is what they're called. So you're not throwing more pigment in those areas that we're correcting with the laser. And then we have ablative lasers, and ablative lasers really move the laser or the needle. And so they really will move a needle on any skin tightening, fine lines that you're trying to correct. The level of ablation depends on your Fitzpatrick skin type. So your genetic makeup, what color your skin is, how much
Mm.
melanin you're likely to throw after injury. So,
Wow.
and then
Interesting.
also, it's dependent upon the depth of your wrinkles and or skin tightening that you're trying to achieve. So we love, love, love a CO2. We love our CO2 here. It's amazing. We bundle it often for our patients with a biostimulatory type of filler because you're stimulating collagen in 2 different pathways in the same day, and you
Oh,
really
wow.
can help boost the patient result. But there's significant downtime with that.
Mm.
And it can be a week to 2 weeks, some patients 4 weeks, depending on the depth that we're going and what our goals are. And in our treatment rooms, we have videos of afters so patients understand
What it
what,
looks like, what you
yeah,
look like.
yeah,
I'm
yes,
not commenting on this at all.
Ah.
yeah, yes. So some patients will look like a blowfish. I'm one of them. I have my before and after.
I was Jiminy Glick for
Yeah.
sure.
And I'm too afraid to try. So we've got a range here.
It is the best. I think it's the best. And it wasn't that long of a downtime, I have to say. It was only a couple days, but there was one day that was pretty scary.
Mm.
And I wrote to Brittany, I go, is this normal? And it was not normal.
Oh gosh.
And then
Oopsie.
someone said, would you do it again? And I said, in a heartbeat, in a
Yeah.
heartbeat.
Yes. Yes.
No pain, no gain.
Yes. Yes.
Oh my
Yeah,
goodness.
100%
everyone
worth it.
swells differently. So some people swell a ton, some people
Okay.
swell less. It depends on your histamine response. And then when we combine it with a certain type of biostimulatory filler, patients swell more.
Okay. Makes sense. So, are there any misconceptions that people have about professional treatments that are kind of like a regular thing that you're hearing when people come in, or just, I don't even know?
You know what? There's not so there are some misconceptions, but I don't think they're necessarily unwarranted when it comes to energy-based devices.
Oh, okay.
Yeah, the FDA just came out with a warning against radiofrequency microneedling for patients
Oh,
who've been getting burned by it.
Oh, okay.
And it's not the device, it's the way it's being used. And so unfortunately the med spa industry blew up. So it became a lot of it was unregulated, and it still is unregulated, meaning an internist, a physician can buy this device and start using it, but they've never used it before. They've
right.
never dealt with the skin. They don't, maybe they prescribed some, steroids for rashes, but that doesn't equate to using an energy device for the skin, right?
Sure.
So there definitely has been some user errors where patients have been harmed that have been reported to the FDA, and the FDA, out of, their due diligence, they wanted to protect the public. They said, hey, this type of equipment, be careful. And it is really important that you choose who does this wisely. I
Yes.
would say, as a general rule of thumb, if they're running a ton of specials, And as a general rule of thumb, it's true. I own a business. I look at our overhead. I don't understand how some of these clinics can run these specials because they're running it for below cost
Oh,
even.
wow.
So it's often you are the guinea pig. So they're running those specials to get people in the door and get their staff
Mhm.
trained on you. So it's important
Wow.
that patients understand that because we spend a lot of money on training our staff,
Mm.
and our staff has to before we bring in a new device, they not only do they do formal training, but then they have to practice on X amount of patients, have it logged, and then they do their final sign off with David or myself before
Mhm.
they're able to be booked
Oh,
to
wow.
see a patient. So there's a significant amount of time investment and of course dollars that the onus should be on the business to train the staff. And
Mhm.
so that is reflected in the price that you see often. And so a lot of some places that I see when they run these specials, it's a brand new grad, someone who's inexperienced that's doing it. And or they're using very, very minimal settings that won't deliver the result that is promised, right? Because it's a safe result or a safe setting.
Yeah.
So yeah.
Are there any treatments that people jump in too quickly before building a foundation?
So over the years, I think right now we're seeing in the aesthetic industry, the pendulum always swings. The last probably 8 years, the pendulum was big, overdone. It was Kardashian style,
Yeah.
bringing it back
Yeah.
to Kim's. Um, Big lips, big cheeks,
Yeah.
high arched eyebrows, big bottoms, voluptuous everything. The more, the better. And there were even patients in that would fly in from the West Coast that really wanted that overdone look because it was a status thing,
Yeah.
Yes.
right?
Interesting.
Now the pendulum has swung the other direction, and it's far more subtle. It's understated. It's clean girl beauty,
Yeah.
right?
Right.
Clean faces, clean makeup. And so I believe about 8 years ago, we were doing too much, listening. It was patient directed, is what I should say.
I
So
see.
would say, "Oh, I want more on my lips. I want more on my lips. I want more on my lips." And a lot of us, we ride this fine line of we want to make the patient happy. This is their perception of beauty. But at the same time, this isn't looking good anymore. How do we tell this patient no? And I think that that is where, when people jump in too quickly, is when the patient's focused on, I only want my lips done. I
Mm.
want you to give me a full face assessment and let me know what you feel like would be the best choice for me. That's where I see us running into problems. When patients, if they're looking at, the next TikTok influencer, right,
Right.
recommended this device or laser,
Right.
might not be appropriate for them. So it is really important that you have a relationship with your aesthetic provider and you trust them. You have rapport back and forth. And this is what I tell everybody, even my injectors. Something's going to go wrong, regardless of at one point in our careers, multiple times in our careers, no matter how good you are at your job. The human body is so variable, so variable.
True.
And sometimes it's not even what went wrong in the treatment room. It's what goes wrong at home when the patient's healing. Sometimes patients sleep in their, cat is in their bedroom or their dog
Oh,
sleep in
I'm
Sure.
the
Sure.
sure.
bedroom,
Sure.
right? And so we're dealing with the sequela after that. Make sure before, as a provider, this is what I tell my providers, you can handle whatever complication of the you're dealing with, right? So if you're injecting, the worst complications are going to be a vascular occlusion, blindness, stroke. You have to be able to deal with it. You have to know your protocols. You have to run it like you would your ACLS and an ER.
Yeah.
As and that's very, very important. And then as a patient, make sure you trust the person you're with, that if something does go wrong, that you deal with it with them.
Yeah.
Because we're complications clinic too. So I have a lot of people who come in from other clinics with terrible complications. And I often wonder why they didn't stay. And I'll ask them, was the provider, did you talk to, does your provider know this is going on right now?
Yeah.
First of all. Some of them will say, I don't trust them anymore. I'm not even talking to them.
Hmm.
And I think that's such an unfortunate part because they know what they did as far as what area they
Yeah.
injected in. I'm kind of guessing now. I can fix it, but now I'm kind of guessing because I don't have a
Sure.
patient chart often. So as a patient, please, please, please trust who you're going to. So usually it's not going to be someone who you met for the first time off of a Groupon or a special, right? It's usually someone that you've developed a relationship with.
Yes.
Start going and getting your general facials there, your light Botox,
This is
develop
so.
rapport. And then you can dive into the riskier procedures.
Yeah. Good point. Good point.
I just want to like emphasize that Brittany has fixed so many problems for so many people. And a lot of my friends have said, "Oh, do you want to share Botox?" Or Botox is only,
Oh
I'm making up the
gosh.
number, I don't know, $10 a vial. And I'm like, it's your face. We're not looking for discounts. And I just want to reiterate what Brittany said about your provider or your person must be able to fix if there is a problem, and a lot of them can't. So this is not, you're not getting a dress on sale that you can put in the back of your closet if you don't like it. These are medical grade situations and treated as such. I'm just saying that because I know what you've done and I'm very impressed, obviously. Okay, switching, I want to talk a little about red light therapy because it's everywhere. What is it actually doing to the skin? Is this something we should be exploring?
So, yes, red light therapy, it's FDA approved for inflammation. It helps increase healing, essentially, and can reduce bruising. So some plastic surgery or like longevity wellness clinics will have it after a treatment. You can do your red light, it's LED therapy,
Hmm.
um, and just to help overall reduce inflammation. Great. What a lot of people aren't doing, they're hoping, what a lot of people don't understand is you have to do it every day in order for
Okay.
it to be effective. So as long as you stick to it every day, it definitely is effective. Some wavelengths will smooth out fine lines. It boosts collagen, elastin, uh,
Wow.
but you need to do it every day. And so what I recommend for my patients. It's not a brand necessarily, but make sure you have something that you can use every day. I usually recommend a light panel that they can lay underneath and relax, play either some nice meditative music or listen to a good podcast
Okay.
towards their time, 20 minutes a night. Usually look at the manufacturer's guidelines because every wavelength is different.
Right.
But anything you do at home is generally like subclinical strength.
Okay.
So you have to do it regularly in order to move the needle.
And so the light panel for your face, you're specifically talking the face? Because I know there are like blankets and beds, and there's so many products out there. So I guess whatever you can do, it's probably good for your whole body at some in
Yeah.
some way or another.
There's red light body treatments. It looks like a tanning bed, but
Yeah, yeah,
red light therapy,
yep,
beautiful. I mean, not very many people can have, you know, either afford those or bring them into their home
right.
They
space.
take up half the house, right?
Yeah, they do. And I know also hyperbaric oxygen chambers people are bringing into their homes now. Really moves the needle in
So you're a
anti-aging.
fan of those. So those they're working. Yeah, if you can do it, right? Yeah.
Amazing
Yeah, yeah,
if you
yeah.
can do
That's
it.
so
Did you
interesting.
see even what's his name? Brian live longer with he's the like oh my don't die guy. Brian, I forget his name.
Oh,
I'm into
yes,
all
yes,
that stuff, so I'm surprised I haven't. I just
yes. I know
remembered
who
when
he
I
is.
was at
Yes.
Canyon Ranch, they had a whole red light like area with all the things, like from the chairs to the beds to it was just so mind blowing to me. And so I
Yeah.
finally broke down and bought a mask, but I'm like, do these really work? So it's good to hear from your perspective um,
I
that
mean,
they do.
I'm a big fan of the hyperbaric oxygen chambers. If you can
Okay.
if you can get one, there's one in Lakeview too. But Brian, I think from Don't Die, his team released his stats on it, and I think he dived down to like 2 atmospheric
Oh,
level.
wow.
And I believe it was like 20 minutes a day.
Okay.
And his collagen production, wrinkle reduction, and his cellular output increased dramatically. So definitely,
Really
yeah. And we use it even in for surgery for post-op healing, or if anyone's had
interesting.
is healing slower, we send them there. If anyone has a vascular occlusion, that's in protocol as well, because it really helps with cellular healing.
Love that. Love that. Let's see
Well,
where.
how do we start evaluating our skin? Like, what are the things that we should pay attention to?
So when you're looking at your skin, the first thing is generally the first signs of aging is overall dullness.
Okay.
So the skin itself just looks dull. It's not dewy and glowy
Mm-hmm.
anymore. And then you're going to start to notice some fine lines. You'll start to notice some dyschromias, which are could be sunspots, freckles, actinic keratoses. Those are things that you're going to start to see. So when we're evaluating our skin, look first for the overall luminosity of your skin.
Okay.
Want to see a nice light reflex. You want the skin to look dewy or glowy overall. And that's the sign of, quote unquote, youthful skin,
Mm-hmm.
healthy skin. And then in derm, we say pretty skin is cancer-free skin. So that's when you eliminate dyschromia. So that will help with the overall luminosity of the skin, is reducing pigment disorders,
Okay.
reds, browns in the skin. So that's the first way to start looking at it. And that's when you throw in your retinol if you start noticing some dullness.
Interesting.
Great.
And should we change our skincare seasonally, or do we just keep the same routine and on repeat?
So you don't need to change your skincare seasonally. You might have to start using products more often. You might need to change your face wash depending on where you're at in the world. If you tend to produce more sebum, oil, which is oil and or sweat during certain months, and you're noticing breakouts. If you start noticing changes in your skin, that's when you might want to change your skincare lineup to
Oh,
address
interesting.
skincare
So like a
concern.
richer moisturizer in the winter, maybe when you're drier or that kind of
Yes.
thing.
If
Okay.
if you experience that, right?
Okay.
Some people don't, but usually some do. A lot of us in the Midwest with heat on for a long time, we start to get eczema, dry patches. So then that's when you want to change your skincare. But otherwise, once you get into a good routine, stick with it until your skin tells you otherwise.
Makes sense.
Interesting.
And
It'll
how do
talk to you.
lifestyle factors like stress or sleep, maybe hormonal changes, how does that show up in the skin?
Oh my goodness. That's a great question. So we call it cutaneous manifestations of internal disease.
Ooh.
So skin will tell you everything. Yeah.
Well,
I need
So
to say that 3 times fast.
yeah. Your skin will tell you everything. And we didn't understand for now, thank goodness we know so much more about peri and postmenopausal
Yes.
women. And we didn't understand that even lack of sleep, the sleep disturbance due to hormonal disturbance, how it affected the skin and your
Mm.
body's ability to heal,
wow.
your body's overall moisture levels as well. So absolutely, lack of sleep leads to higher stress hormones, cortisol, and when you have higher stress hormones, you have high inflammatory reactions on the skin. And then that's when you have higher inflammatory reactions on skin, you're reducing the skin barrier, right? So the
Mm.
microbiome of your skin, the skin's ability to protect itself from external extrinsic factors out in the environment.
Sure.
And so absolutely lack of sleep, high stress, even spicy foods can affect your,
Really? Spicy
yeah,
foods. Okay.
yeah. Spicy foods, and even people get contact or like perioral dermatitis, it's often from your toothpaste or spicy food
Wow.
irritating the skin, and it causes inflammation, which then breaks down the skin barrier, and then you get an secondary infection from it. So sleep is the best thing you can do to help your skin heal, to help your body heal, but certainly.
Really? Okay.
Mhm.
Let's get into some rapid fire questions. We kind of like to do this towards the end, and This is just meant to be like a couple word answer or a sentence if you feel like it needs to, but just to give people some quick tidbits of expertise from you. So, Ricky, why don't you take it away?
Okay, first one, retinol thins your skin.
Does not thin your skin. That is a misunderstanding. It actually will thicken your skin, but it does thin the dead layer.
Okay, cool.
Excellent.
Drinking water fixes dry skin.
It will help dry skin, does not fix dry skin.
I like fix, but I guess help is good enough. Acne is caused by dirty skin.
No, that's so sad. And that's inaccurate.
Okay, cool. You should exfoliate every day.
Not you should. Not every skin can tolerate it, but a mechanical exfoliant can be too irritating. A chemical exfoliant like a retinol, yes.
Okay,
Okay.
cool.
What is the number one thing most women over 40 should incorporate in their skincare routine? Like the top thing.
So if they're already using the basic four,
Okay.
right,
Yes.
then I would start looking at an estriol face cream.
Whoa.
Oh,
Mhm.
okay. Tell us really quickly what that is because I'm so curious.
So it's estrogen. It's an estrogen
Yeah, I
derivative.
figured. Okay.
Face cream. So because we're losing estrogen in our skin, our estrogen levels are declining,
Yes.
our collagen production is declining, skin laxity starts to appear. You can apply that locally, so topically at the source that we're starting to see laxity, which is usually around your eyes, upper lip, neck.
Interesting. And is that something you should coordinate with your practitioner if you're doing hormone replacement, or you can just do that on your own?
I would coordinate that with your practitioner. There are online programs that do it, I think like Alloy or something, but the potency is super little. So if are you already working with someone like our
Yeah,
clinic, for example, we prescribe it and we
I
mix it
see.
with peptides and hyaluronic acid. So if you're already seeing someone, I would
That's
talk
so
with them.
interesting. Okay, and then I have a question. What exactly is face tape and how do you use it? Because I didn't know what it was when I saw like a pack of it, and I was like, they kind of look like Band-Aids, but they're not, but they're really pretty. But oh, it's face tape. What do I even do with this?
So, face tape, I want to give credit where credit's due. There's a mom and daughter duo, and they're called Frownies,
Oh,
and they swear by they don't use tox, so that they've prevented a lot of their wrinkles by using face tape every single night. I did try it. It was too harsh for my skin. It was like taking off a Biore pad at night.
Oh,
For me.
gosh.
So I like more gentle face tape. We have our own, so we ended up making our own, or you can
oh,
go on Amazon. And on Amazon, just get exercise tape and you'll cut it down to the appropriate level. So for our face tape for me is for our side sleepers or belly sleepers, and it's only a skin splint. So it will not stop wrinkles formed by muscles. It will prevent wrinkles that are formed from constant contraction in an area or
oh.
pressing at it, like when you side sleep and you do
On the
this,
side, yeah.
Okay.
it can prevent those lines from forming
Oh,
Ah.
wow.
So do you
because you put it right over there and it's a
right?
skin splint.
That
Yeah,
is
so you're
so
not creasing in
cool.
that spot. So when people wake up and they've got like these heavy duty lines on their forehead,
Yeah,
those are side sleepers. Face tape, you won't have it.
that
Wow.
is amazing. Wow. Okay, I have
Run.
to say I've learned so much. I know Ricky's a skincare junkie. I basically
Hardly.
ask her questions when I have them, and now she's like, we have to get Brittany on because she knows so much. And wow, I'm so impressed. What a treat to have you here to really help us understand the myths and the truths and what we need to hold on to when thinking about our skin. I mean, our skin, it's like our largest organ, right? Like we need to take care of it as
Yeah.
best as we can, whether it's product or with services. I mean, we all want that want to maintain or get that youthful glow. So, oh my gosh, thank you so much for sharing your incredible knowledge and expertise. I know everyone listening is just blown away like I am. So, thank you so much.
Thank you for having me on. It was such a pleasure. I love chatting with you guys. Actually, my favorite part when I saw the the questions were sent over, it was you guys catching up. I'm like, I cannot wait to hear what they're going to talk about.
Oh, thank you. We love catching up.
Oh, thank you.
That's
And
so sweet. Thank you. We appreciate that.
we do. And also, you guys, if you learned something about skincare today, and of course you did, I don't even have to ask, please share your thoughts and please remember to send your comments. Follow us on Instagram. Just a reminder, on Instagram, we have that fabulous giveaway and it's going on for a few days. It's worth $350, sorry. And if you're ready to book your appointments at Fulcrum, you'll also receive that amazing Aura skincare analysis consultation that's worth $150 value if you mention Chatterbox Besties when you book your first new patient appointment. And all of this will be in the show notes as well. Thank you.
Thank you so much. Thank you all for joining us at Chatterbox Besties with Brenda and Ricky for our fabulous skincare episode with Brittany at Fulcrum Aesthetics. Please share this episode with someone you love to share the truths about skincare, because we're all wondering and learning, and what a great recap for all of us. And remember to rate our show on our podcast and on our Instagram. We love you all. Thank you again, Brittany, so much. And we'll see you soon on Chatterbox Besties with Brenda and Ricky.
Thank you so much. Bye.
Bye. Hi there. This podcast is purely for entertainment purposes. We're your besties sharing our perspectives with you.